The goal of this video lecture is to review the different disorders that are categorized as substance-related and addictive disorders in the DSM-5. The category of substance-related and addictive disorders in the DSM-5 is a large one. It's over 100 pages long and includes over 50 separate disorders. The defining characteristic of these disorders is that the individual continues to use a substance or engage in a behavior despite experiencing significant substance-related problems or problems related to the addictive behavior. These include the substance-related disorders. We can roughly divide these into substance-induced disorders, which include substance intoxication and substance withdrawal, and the substance use disorder. And the DSM provides separate diagnostic criteria for each of these three disorders for 10 different sets of substances. This category also includes gambling disorder because of evidence that gambling behaviors activate reward systems in the brain that are similar to those that are activated by psychoactive substances, and because the behavioral symptoms of gambling disorder are similar to the problems that we see in substance use disorder. So there has been some discussion of potentially including some new diagnoses in this category. For example, behavioral addictions such as internet addiction or shopping addiction, but those are currently not supported by as much evidence as gambling disorder. So gambling disorder is currently the only non-substance related disorder that's classified in this category. Substance intoxication is our first substance-induced disorder, and substance intoxication is characterized by the development of a reversible substance-specific syndrome due to the recent ingestion of a substance. And the individual experiences clinically significant problematic behavioral or psychological changes associated with the intoxication from this substance, and those problems can be attributable to the physiological effects of the substance, and because of that, we can see that they develop during or shortly after the substance use. So, for example, the diagnostic criteria for stimulant intoxication specify that an individual has recently used an amphetamine-type substance, cocaine, or other stimulant, that they're experiencing clinically significant problematic behavioral or psychological changes, for example, euphoria, changes in sociability, hypervigilance, interpersonal sensitivity, anxiety, tension, anger, stereotyped motor behaviors or impaired judgment that developed during or shortly after their stimulant use. And they also need to exhibit 2 or more of the following symptoms during or shortly after their stimulant use. So for stimulant intoxication, this includes tachycardia or bradycardia, that's rapid heart rate or slowed heart rate, dilation of the pupils, elevated or lowered blood pressure, perspiration or chills, nausea or vomiting, weight loss, psychomotor agitation or retardation, muscular weakness, respiratory depression, chest pain, cardiac arrhythmia, confusion, seizure, or unusual motor behaviors, or coma. So you can see from this list of symptoms that this is the characteristic syndrome associated with stimulant use, and we can directly attribute it to the person's ingestment of that substance. So the symptoms are developing either while the person is using the substance or shortly after. And this intoxication is causing clinically significant problematic behavioral or psychological changes. So this is a disorder that we typically see in emergent settings. So for example, an individual meet diagnostic criteria for substance intoxication if they present in an emergency department. So for example, someone who has recently drunk a large amount of alcohol and is experiencing the characteristic symptoms of intoxication, is having clinically significant problems with their behavior or psychological consequences, or an individual might present in an emergency department under the influence of hallucinogens and be experiencing behavioral or psychological problems related to the active effects of those hallucinogens. So because these symptoms are directly attributable to the active effects of the substance, this is not a disorder that we tend to see long-term. When the effects of the drug wear off, the person is no longer experiencing substance intoxication, but in short-term emergent settings, so for example, police officers or in an emergency department, you might see individuals who are meeting diagnostic criteria for substance intoxication. Our next substance-induced disorder is substance withdrawal. And substance withdrawal is characterized by the development of a substance-specific problematic behavioral change associated with physiological or cognitive symptoms due to the cessation or reduction of heavy or prolonged substance use. And importantly, these withdrawal symptoms are associated with clinically significant distress or impairment. So again, the diagnostic criteria are going to be substance-specific and are going to capture the characteristic withdrawal syndrome that's associated with a given substance. So when an individual is experiencing withdrawal from a substance, typically because they've been using that substance over a prolonged period of time or at a high level, when those withdrawal symptoms cause clinically significant distress or impairment, that would be an appropriate context to give a diagnosis of substance withdrawal. And again, the diagnostic criteria are going to be specific for a given substance. So for example, the diagnostic criteria for tobacco withdrawal require daily use of tobacco for at least several weeks, and abrupt cessation of tobacco use or a reduction in the amount of tobacco used that's followed within 24 hours by 4 or more of the following symptoms. And those might include irritability, frustration, or anger, anxiety, trouble concentrating, increased appetite, restlessness, depressed mood, or insomnia. So the specific symptoms that are included in the diagnostic criteria are going to vary depending on the characteristic withdrawal syndrome that's associated with a given substance. The amount or frequency of the substance used required for diagnosis might vary by substance. The duration after cessation of use required for onset might vary, and the number of symptoms might vary. But the thing that ties these disorders together is that they're characterized by the characteristic withdrawal syndrome that's associated with a given substance that is causing problematic behavioral changes or physiological or cognitive experiences that are associated with significant distress or impairment. Primarily what we see in treatment settings are what we call substance use disorders. So these are disorders that are characterized by a cluster of cognitive, behavioral, and physiological symptoms that indicate that an individual is continuing to use a substance despite experiencing significant substance-related problems. So a pretty typical wording for the diagnostic criteria for a substance use disorder in the DSM is a problematic pattern of use, and that might be a problematic pattern of alcohol use or a problematic pattern of amphetamine use, leading to clinically significant impairment or distress as manifested by at least 2 of the following symptoms occurring within a 12-month period. We've got a problematic pattern of substance use, and again, the diagnostic criteria are going to vary depending on the substance. It's leading to clinically significant impairment or distress. We have a minimum of 2 symptoms, and we have symptoms occurring within a 12-month period. And broadly speaking, the DSM categorizes these symptoms in 4 different groups. So these are symptoms that might indicate impaired control, or that a person is not able to control their substance use. Social impairment, so experiencing problems meeting major role obligations as a result of substance use. Risky use, so that might be using a substance in contexts in which the person is at risk for physical. So there are many substance-related disorders that are included in this category. So remember that there are different diagnostic criteria for disorders associated with substances in 10 different categories. So there are over 30 substance-related disorders in this section of the DSM. So for most of the disorders, we have diagnostic criteria for substance use, substance intoxication, and substance withdrawal, but there are some notable exceptions. So for example, there are no diagnostic criteria for a caffeine use disorder. There are no diagnostic criteria for tobacco intoxication, and there are no diagnostic criteria for hallucinogen withdrawal or for inhalant withdrawal. We do have an interesting disorder associated with the cessation of hallucinogen use. This is called hallucinogen persisting perception disorder, and this occurs when an individual continues to have symptoms associated with the hallucinogen use, so they might have altered perceptual experiences for a significant period of time, even after they are no longer experiencing the psychoactive effects that can be directly attributed to the hallucinogen intoxication. So you can see that this is a very large category of disorders that includes a very wide range of disorders associated with many different types of substances. And the specific diagnostic criteria associated with each of these disorders is going to vary based on the characteristic intoxication symptoms associated with the substance, based on the characteristic withdrawal syndrome, or the symptoms that people typically experience after they stop using a given substance, and particular symptoms reflecting the characteristic problematic behaviors that we see associated with problematic substance use for each of these individual substance categories.